This is a production of WTVI PBS Charlotte.
Set, go!
Sprinting down the hallway and fighting the force of resistance bands.
Step.
Students at Oak Ridge Middle School train to be track stars.
Set, go!
But something sets 12-year-old Hannah Self apart from the rest of the pack.
They said her blood sugar was 740, and I said, okay. And he said, Mrs. Self, normal blood sugar is 100. You need to get to the emergency room right away. And so that started our journey.
Hannah suffers from type 1 diabetes, an autoimmune disease developing when a person's pancreas stops producing insulin. The diagnosis brought Hannah's carefree childhood to a halt.
Hannah was in the hospital for 3 days. She got started on insulin, and she immediately started feeling better.
Then a healthy 8-year-old. The diagnosis came as a shock. Each year, doctors diagnose about 30,000 people across the U.S. with type 1 diabetes, formerly known as insulin-dependent or juvenile-onset diabetes. About half are children. Researchers are still trying to understand what causes the disease. Many believe it's a combination of genetic factors and environmental triggers.
There really is nothing that we could have done to prevent Hannah being diagnosed with type 1 diabetes.
There's also no cure.
People think that insulin is a cure. It's not a cure, it's just a treatment.
37-year-old Patrick Houston says he was blindsided when doctors diagnosed him with diabetes about a year ago.
That day I was in the hospital, I decided to do everything. I knew eventually if I didn't make some kind of change, I was going to die.
Patrick suffers from type 2 diabetes, formerly known as non-insulin dependent or adult onset diabetes, meaning his body makes insulin but doesn't use it properly.
And then your pancreas's job is to make insulin. So
doctors say type 2 diabetes is often preventable. Being overweight and having a family history of diabetes raises your risk for developing the disease.
There's a 2 to 3-fold increased risk of developing diabetes if you have a first-degree relative with diabetes.
The CDC, or Centers for Disease Control and Prevention, say 21.9 million people across the U.S. have diabetes. Nearly 95% of those people have type 2 diabetes. Millions more are at risk for developing it. 86 million Americans, or nearly 1 in every 3 people, have prediabetes, a condition easily detected through a simple blood test.
It increases risk of heart attack, eye problems.
Dr. Michael Hoban recommends getting screened for diabetes annually.
It's silent until the sugar numbers start to get fairly elevated. So some of the cardinal signs we tell folks to look for are excessive thirst, excessive urination, tired all the time.
Once I was diagnosed, I discovered, okay, this is why I probably feel sluggish all the time.
Unlike type 1 diabetes, type 2 diabetes can be delayed, even prevented with a healthy lifestyle.
There's data to show that just lifestyle modification with diet and exercise can reduce the progression of diabetes and the complications by up to 50%.
When I was told I had diabetes, my first thought was, dang, I gotta give up Kool-Aid. And I hated that.
Patrick weaned himself off insulin shots and lost 40 pounds through a healthy diet and regular exercise. But for people with type 1 diabetes, a healthy diet and exercise will never replace doses of insulin. Hannah checks her blood sugar level 8 times a day by pricking her finger, placing a drop of blood on a test strip, and inserting the strip into a glucose meter, getting a reading in seconds.
I'm used to it, but it never really gets easier.
She constantly balances doses of insulin with the food she eats and activities like this.
So my blood sugar is 96 right now.
Today, her blood sugar level falls in the normal range before practice, meaning she doesn't need an insulin shot, just a snack to make sure her blood sugar doesn't drop too low during practice.
All right, guys, get ready. On your mark, set, go!
For diabetics, monitoring blood sugar levels is crucial. Left uncontrolled, the disease can lead to serious complications, such as blindness, kidney failure, heart disease, stroke, and loss of toes, feet, or legs.
It's clear that the complications from diabetes go up the longer you have the disease.
I just took ownership of my life. I don't want to do this anymore. I don't want to go down this path anymore.
Each day, diabetics like Patrick and Hannah work to control their diabetes so the disease doesn't control them.
I think diabetes has taught me that I can really do anything and I shouldn't let anything get in my way.
Hannah puts her words in action, pushing through practice alongside her teammates, refusing to let countless finger pricks take away her spark. Hannah's smile reflects her determination to take her diagnosis in stride. For Carolina Impact, I'm Danielle Kosir reporting.